Well, my name is Skip Bazet. I live here in Columbia, Missouri. I'm a retired firefighter for the city. And 4 months ago to the day, I had a stroke. My wife found me in bed before she left for work that morning, and she noticed some drooping on my face, and I told her I needed to get up to go to the bathroom. And I actually asked her to get off my legs, and she said she wasn't on my legs. She kept asking if I was all right, and I said I was fine. And she said she was going to call 911. I told her no, I did not want her to call 911, that I was just fine. Luckily for me, she decided to call 911, and they responded quickly and carted me off to University Hospital. After I came to in the hospital, I was told that I had a stroke, which my wife surmised, and that I had a complete blockage. And they told my wife that they were going to have to go in, and they had basically three options. One, that I wouldn't make it. One, that I'd be in a rest home possibly for the rest of my life. And two, that they could unclog it and retrieve it. And obviously they went in there and unclogged it and retrieved it, and that's why I'm here today. Dr. Nanda is one of 6 or so teams in the United States that could perform that kind of operation, and I guess I was pretty lucky where I was. I stayed over just one night because I know it was the 22nd when I came in. It was like a couple of days right before Thanksgiving, and I remember Jamie very well because she was the one that got me up and walking around. And again, I was feeling pretty good. I was having a little trouble the very first day touching my hand to my nose, my left hand. I was kind of reaching, and I was having trouble with that. And she finally got me up walking around, and I remember being agitated because I'm quite active, and I kept telling my wife, I said, if she would leave me alone, I could walk. But she kept saying, well, you're listening to this side, and she was trying to get me to walk stairs, and I felt like I could do everything, but I was actually having a little trouble. So she got me into Rusk. By the time I got to Rusk that following Monday, they had me do several tests, and they basically told me that I didn't need to be there, so that I was doing so well already. So, and since then, my birthday was Saturday, and I turned 61 and ran the 5K in the morning of the St. Patty's Run. So I'm doing real well playing golf. I'm back to right where I was. Well, again, just like any medical emergency, the quickness in response is essential for blood, oxygen, anything. But a stroke, probably more so. One of the things I would recommend is that everyone learn the signs and symptoms of a stroke, and not just for yourself, but for other people, your loved ones, and people in the house, your neighbors, someone that you could come across in a mall that you would recognize the signs themselves. Because even though you might know it, the people around you might not know it, and it's very, very beneficial. It's what saved my life, by my wife knowing it.